Today we are talking about the female orgasm, or more specifically, when the female orgasm is elusive. We are diving into the sexual dysfunction anorgasmia, which is characterized by delayed, infrequent, or less intense orgasms, even after sexual arousal and adequate sexual stimulation.
Welcome to the Pleasure Program. My name is Holly.
I'm Victoria.
We are two licensed therapists specializing in sex therapy, here to share our knowledge and answer your questions around all things related to a healthy and pleasurable sex life. This video is part of our Pleasure Program Quickie series, where we are covering one topic in sex education relatively quickly.
As we said, anorgasmia, is when women struggle to orgasm at all, or it takes forever, or it's less intense, even after adequate sexual stimulation and sexual arousal. But that's kind of vague, right? Like, what exactly is adequate sexual stimulation for a female?
Yeah, it's subjective, I would think. What is adequate for one person might not be adequate for another.
Absolutely. But we can give some general advice for this based on, some things that we've even talked about in our last videos.
When considering if sexual stimulation is in fact adequate, one of the things you want to be mindful of is clitoral stimulation. So this would be the stimulation of the clitoris on your female partner, and this could include at least 20 minutes and sometimes more of manual stimulation or oral stimulation, the use of a toy, along with proper communication between you and your partner, so that sort of the pace and the speed, and that there's a buildup in the stimulation, that this type of sexual stimulation is in fact adequate. Also, don't be confused if there is a lack of lubrication. That is not necessarily indicative of the level of arousal or excitement your partner is experiencing. So that is a common misconception. It's not always sort of the measure. It's not the measure. Yes, the level of lubrication is not really a reliable measure of how aroused your partner is in fact. So that's why communication is important. Make sure you're communicating and you're giving feedback and listening in terms of how much pleasure your partner is experiencing.
So if you feel like you've engaged in adequate stimulation and you've achieved adequate sexual arousal, but you're still struggling with orgasms, let's talk about some of the causes that might be going on. And causes for anorgasmia include both physical causes as well as psychological. So let's start with the physical causes. First, similar to, some other sexual dysfunctions that we've talked about, sometimes anorgasmia can be prompted by or induced by medication. So some antidepressants or antipsychotics have been associated with difficulty with orgasm. So talk to your prescriber. They could, reduce the dose, switch the medication, add an additional medication that could counteract these effects. Talk with them and see if they feel too that this might be why you're struggling with orgasm.
In addition to prescribed medications, there are other substances that can impact one's ability to achieve orgasm. And these would include nicotine, alcohol, heroin, cocaine, as well as stimulants such as amphetamines and MDMA. And this might be a little confusing to hear or to learn, because initially the use of some of these substances can increase desire, increase some stimulation, but research indicates that prolonged use of these substances do have a negative impact on orgasm.
Next, also, if you're someone who has gone through menopause or you're going through menopause, this can be another inducing factor of anorgasmia. More than a third of women in perimenopause or menopause report sexual difficulties, such as difficulty with orgasm. This is because there's declining levels of estrogen, which can impact arousal. It can cause discomfort, which would definitely impact ability to orgasm. So you can talk to your doctor about maybe hormone replacement therapy, review some of the medications you're on, try products such as like lubricants and moisturizers.
Another cause of anorgasmia would be a pelvic pain disorder. We have a video called When Sex Hurts that we will link below that really covers a lot of information on pelvic pain disorders and the treatment for such a disorder. But it kind of makes sense when you think about what would get in the way for somebody to achieve orgasm. Being in pain is, and an unwanted pain is certainly going to be a barrier.
And on top of that, there are other diagnoses that could be associated with anorgasmia, such as epilepsy, Parkinson's, fibromyalgia, MS, diabetes. So if you're diagnosed with a medical condition and you're struggling with anorgasmia, definitely talk to your doctor to see if those two things might be linked and if maybe treatment can kind of coincide so that you can be treating the initial diagnosis of the physical health issue along with anorgasmia. It's really important to see someone, talk to them, do a lab workup to assist in ruling out any medical cause or difficulty to make sure it's not physical. But if it's not physical, there's also psychological that we will dive into. Anorgasmia that is not actually caused by a physical medical condition can be classified as female orgasmic disorder. So if you were to see a therapist, sex therapist, and a physical issue was ruled out, you'd be likely diagnosed with this, just to help drive a treatment plan as part of the DSM, just kind of standard practice.
If you have health insurance for your insurance to cover, there needs to be a diagnosis so that they know what they're paying for, what the treatment is for. So this diagnosis would help you get access to that kind of insurance coverage.
So your therapist would just make sure you're kind of experiencing these difficulties in almost all of your sexual encounters or sexual activity for a minimum of about 6 months. And that it's also causing you distress. If you're not having orgasms and it's not causing you any distress, you won't really qualify for this disorder. And it's okay if it's not causing you distress and you're happy with it. Okay.
If someone is struggling with anxiety, that can certainly be a psychological factor that can inhibit one's ability to achieve orgasm, or it might delay orgasm or cause very infrequent orgasms. Also, sexual trauma, having experienced a sexual assault or sexual abuse in your history would certainly create a negative association with sex, which will get in the way of one's ability to experience pleasure and be present and embodied, which would ultimately lead to orgasm. So you could see why anxiety certainly would be part of that experience as well. So anxiety, trauma, all of that are psychological factors that can get in the way.
On top of that, a lot of people unfortunately struggle with sexual guilt or sexual shame. And this is also associated with having a difficulty to achieve orgasm. You know, not only does it cause anxiety or depression, and that interferes with the ability to feel pleasure. You know, there's research that shows that women who initiate and are more active participants during sexual activities report more frequent orgasms. And if you're experiencing sexual guilt or shame, you are less likely to initiate, you're less likely to be active, less likely to be present. And so that would definitely interfere with your ability to achieve orgasm. There is, via research, a negative relation between high religiosity and orgasmic ability. What this might mean is, via the research, that if maybe you have really strong religious affiliation or really strong core beliefs tied to religion or potentially really actively involved in religion, then there is an increased correlation with struggling to orgasm.
If you're experiencing any relationship discord, any conflict in your relationship, lack of good communication around resolving such conflicts, or even around your sexual relationship, then certainly those are factors that will also inhibit one's ability psychologically to be present, feel pleasure, and achieve orgasm. This one sort of is a bit mind-blowing, but societal norms can play a role in one's ability to achieve orgasm. So cultures that value female pleasure, women who live in such cultures tend to have more orgasms. Wouldn't you know? There are some cultures where there isn't even a word that represents the female orgasm. And women in those cultures are less likely to have orgasm, especially if there isn't even a word for it.
How do you even identify it? Do
Right.
you do the research?
You're
Right.
like, what just happened to me? I don't even have the vocabulary to describe.
Right.
And really, really interesting and a bit sad that there are cultures that exist that don't even have language for this. It's that undervalued. And then there are cultures that value multiple female orgasms in relation to a male orgasm. Like if there was in ratio, right? Valuing
Yeah.
multiple female orgasms in ratio to a male orgasm. So those women are having a great time.
Yeah. Now that we've covered some of the psychological causes of anorgasmia, let's just dive into some of the treatment options for it. Give some people some hope and some idea of what maybe therapy might look like. If you're diving into treatment with a therapist, something to expect is psychoeducation, meaning that you will receive education from your therapist, just like we're trying to provide education right now, just about reducing that sexual shame and guilt that we talked about, increasing pleasure, such as via describing maybe different techniques to try, teaching relaxation techniques to help you achieve that pleasure, and also just improve your communication skills. Also, they can teach you some techniques to desensitize to your anxiety or just refocus on sensation occurring.
In addition, considering couples therapy is another good option. So if there are any unresolved conflicts occurring in your relationship or you're struggling with your communication with one another, couples therapy will help you improve those skills, help you get to the root of some of the conflicts you're facing, create better connection, and hopefully lead to the right circumstances to create the opportunity for orgasm.
And along with that, some more specific treatments that you might engage in therapy could look like cognitive behavior therapy, where you're assisted in identifying distorted or unhelpful thoughts or beliefs around sexuality and orgasm that contribute to anxiety or depression or difficulty to orgasm, and then help you basically rewrite those thoughts, create a new script with challenging and reframing and whatnot. Or you might engage in something like trauma processing therapy through eye movement desensitization and reprocessing, or cognitive processing therapy just to help you process any sexual trauma that you have that might be relating to the difficulty with orgasm.
And I think if there's shame, sexual shame that someone's experiencing, and maybe in connection with their religious beliefs, as you spoke about earlier,
Yeah.
I think that another sort of approach in therapy would be to work on accepting yourself and kind of leaning into your sexuality and learning to disentangle some of the thoughts that create that shame and that guilt, so that you can feel more liberated and at peace with yourself.
We hope this video helped you get the confidence you need to start tackling any orgasm issues that you face. Let us know in the comments if you have any questions or additional tips or advice to offer others.
Thanks for watching, and we will see you in our next Pleasure Program Quickie.